So why does cancer need to be diagnosed early? There is at the moment an NHS advert which gives two messages really. One is it's really important to be diagnosed early with cancer, and the second is don't worry on your own. See your doctor, get diagnosed, find out if it's something you should have concerns over or not. That advert really, really, really annoys me. Not for the many people for whom it helps. They need to see that if that's what's going to get them in front of a doctor and hopefully diagnose either what's wrong or tell them there's nothing to worry about. It really annoys me because it's not my experience at all, and it's not the experience of an awful lot of people, not just in the UK but all over the world, who have cancer. It's just not our experience. The urgency is there when the NHS decides there's urgency, or healthcare provider, whoever your healthcare provider is. But when they cannot respond in an urgent or timely manner, they don't, and they make you feel as though either it's all part of the plan or you're somehow at fault for asking. Hi, I'm Leah. I have cancer. It's leukemia. And in my experience, healthcare professionals are really well-meaning. Most of them are. And some of them are excellent and highly sought after, know exactly what they're doing. Some are very, very professional and very caring. But their imperatives aren't always the same as mine or yours. Let me give you an example. Before my leukemia was diagnosed, one of the endless appointments I was going to have was for an MRI. I'd already had lots of scans. I was still to have lots of scans. But for this one, it was sent as a request for an urgent scan, an urgent MRI for cancer diagnosis. And that was sent within the hospital. About 10 days later, I got a phone call from the imaging department to say, we'd like you to come in to have your MRI. And I thought, fabulous, fabulous. And they gave me a date to sort of start the ball rolling. And the date was 3.5 months away. And I said, but it's an urgent cancer scan. The member of the imaging team said to me, oh yes, we know it is. This is an urgent cancer appointment. If it was an urgent non-cancer, it would be 3 to 6 months. And if it were not cancer at all, and not urgent, about 9 months. And that's regardless of pain or anguish or anything else that it's causing you, and it's certainly nothing to do with whether your cancer is getting worse and worse. So you see that there is sometimes a difference in what your healthcare professional thinks is urgent or thinks is necessary even, and what you might think is important or necessary or urgent. Those differences in agenda can boil down to, I think, about 6 things. Let's take a look at them. Just because they all begin with D. The first one is denial. And I don't mean the psychological problem of denial, but although that can happen, I do actually mean the outright denial of what you're asking for. Now, that can be a denial in terms of we don't provide that, or what I'm asking for doesn't exist. But be careful, because sometimes it's a way of masking an untruth. It happened to me. I asked about a treatment that was available for my type of leukemia. The consultant told me in a very patronising way that no such thing existed. There was one treatment for my leukemia, and that's what I was having. I have a new haematologist now, thankfully, but that's part of my diagnosis story. But once I got to him, I found out actually there were 5 different treatments for my type of cancer. And yes, the one that I was asking about was one of those 5. The next D is for delay. Often for cancer patients, there is an anxiety, quite rightly, about delays. And it's not that one expects everything to happen when they snap their fingers, but inordinate amounts of delay for no proper reason are pretty unacceptable. I know that for some patients who have surgery to do with cancer, there's adjuvant therapy which is given to them before they have surgery in order to shrink the tumour. There are also neoadjuvants nowadays, but that's a legitimate reason why surgery might not happen as quickly as you might want it. And actually it's to do with getting you the best possible outcome. But there are other times when delays are inherent in the system, maybe just in your area, maybe that's just something that happens, but it's dressed up as being a decision about your healthcare, when actually it's just trying to get you on board with a delay. Deflection. This is something that I find quite manipulative. I don't know about you, but when you make your needs known or you ask for something and nobody addresses what you're talking about, but they try and divert you onto something else in the hope that you'll shut up. The next D is discrimination. And no, it's not that sort of discrimination. I'm not talking about intersectionality or problems that you may have with racism or people who are discriminating you on the grounds of religion, whatever. I'm not saying that never ever happens in healthcare. Of course it does. In my experience, there's much more discrimination that is not even conscious. You need to be aware that being an advocate for yourself is a double-edged sword, because it can have the positive effect of getting the thing that you feel is going to help you best on your cancer journey and get you to your goals. It can also have the effect of just being seen as a difficult patient. It may be that patients who are more articulate, who are young adults or children particularly, are seen as worthy patients, and therefore people will go out of their way a lot to provide them with healthcare, and that's not because they don't deserve it. Of course they do. But it does mean that people who are less articulate, who are maybe street homeless, who have a learning difficulty, have mental health problems, they can find it less easy. And I've watched it happen. And there are also discriminations where mental health is a big one, where people's symptoms, this is pre-diagnosis, their symptoms are passed off as part of their mental health problem or part of their neurodivergence until it's not. So discrimination is something that is there, but I think it's not as common as people might fear. Number next is decision. Those decisions that are taken by others outside of your healthcare team, your cancer team. This can be, depending on where you live or what sort of healthcare you're getting, it could be the NHS, it could be your state healthcare, it could be your insurance company, it could be all sorts of things. But it means that people who've never met you, who've never spoken to you, and may or may not have medical backgrounds, specialist medical backgrounds, should I say, are making profound decisions about your healthcare. Now, you're the only one who can make the decision. Is that a fight that you want to take on right now? There are battles to be fought, and you may feel that this is one that is not going to help you. And the last letter D is for dreadful day, because sometimes when your things that you believe will help you are denied, it can be for the very straightforward reason that it's bad timing for the professional. Now, you can say that shouldn't happen, but we are all human beings. That person, you have no idea. That smiley nurse is looking after you, maybe having dreadful health problems of their own, or could be a carer at the end of their tether. That doctor may be recently bereaved. You have no idea. And so sometimes we have to show people some compassion back and be understanding. And I'm not saying take every bad decision on the chin. I'm just saying there might be times where otherwise wonderful healthcare providers are less than wonderful, and it may be nothing to do with you. So where does that leave the push for early cancer detection? Healthcare providers all over the world are desperate to push for those, and actually it is in our interests as patients to have cancer detected early. So theoretically it's true, but my experience and lots of cancer patients is that that's far from reality. Delays are in the system for lots and lots of reasons. Some you'll find acceptable and some you won't. Now, broadly, there are two types of cancer. There are a gazillion types of cancer, but there are two for the purposes of this conversation. Many cancers need intervention as early as possible to get the best outcome for you. And that's why there are people I know who have been diagnosed and that day they start chemotherapy. And that's what they need. So they need to be handled as quickly as possible because they need to be treated as quickly as possible. There are other cancers, and this happens in blood cancers like mine. There are also certain types of brain cancer and certain types of prostate, I think, which are also like this. We are left on active surveillance. In some areas and with some doctors, it's called watch and wait. And that's because our particular type of cancer there is no benefit to the patient of it being treated early. Actually, they need to observe it, and it needs to do its stuff. And at the right time, your team will then intervene with treatment. And that gets people like me the best possible clinical outcome. It's frustrating and it's soul destroying at times, but actually it's going to get me the best outcome. We also don't forget that medical gaslighting, sadly, is a thing. Thankfully, it's not a common thing, but it does deserve its own video. In order to be balanced about this, we need to remember that although there are too many lives affected by poor healthcare and poor healthcare decisions in cancer, however, there are lots and lots of patients who receive exactly the right treatment at the right time and do return to life's never the same again, but to return to a life without cancer's spectre. But no, life's never really the same. We don't actually know how many patients are in each of those two categories, how many of them breeze through their treatment receiving the best possible interventions, and those who don't. Because people who don't, if they go on to be overwhelmed by the cancer and they die, then the cancer killed them. It won't appear anywhere on their death certificate. It won't appear on their death certificate that a lack of intervention did it. There was a case a few years ago in the UK where a nurse had for a number of years been to her GP, in fact several GPs, and explained to them she was very concerned about the gynae symptoms she had. She was having smears throughout that time, and she was told that various things, that it was endometriosis, that it was in her head, that she was worrying about nothing. Eventually, I believe, I could be wrong, it was a locum GP who cracked it and realised that the woman did have cervical cancer. By the time it was recognised that she did have cervical cancer, it was far too late, and she has died. She was a wife and a mother. And when she first alerted health professionals that something was wrong, nobody listened for a number of years. So for all of the wonderful people who have got through this and got the other side of being a cancer patient, good luck to you. I genuinely mean that, and I hope I join your ranks. But we can't forget the people who don't, and we don't know how many of them are the victims of the diagnosis and treatment, or whether the cancer would have killed them anyway. We just don't know. It's a sad note to leave on, but a very realistic one. Thank you so much for your time today, and I will be talking more about my diagnosis, my two-part diagnosis of cancer, and how I coped with that too. If if you want to help me or help my channel, I'd be delighted if you could press the like button. It's free and it helps me. There are all sorts of ways you could have spent your time today, but you spent it with me and I'm glad you did. Thank you. And I'll see you in the next one.